Good afternoon, and thank you for joining us today for the UMP Plus UW Medicine ACN webinar. My name is Lauren Johnston, and I am a UMP account manager with the Healthcare Authority. Today, I'm joined by my network partners from Regence Blue Shield and the UW Medicine ACN. First, a couple of housekeeping items. If you have a question, please use the chat function in the webinar panel to submit your question. Only hosts and panelists can see your questions, and we will do our best to answer your questions as we can throughout the presentation or at the very end. If we do not get to your question, you can either call the UW Medicine ACN or the UMP customer service for help in answering your question. ACN's customer service teams. There is live closed captioning available during this session, and in a few days, the recorded webinar will be available at the links provided on this slide. In today's agenda, I will walk through what UMP Plus is. The Regence rep will walk through some of their programs and benefit changes for 2025. The rep from the UW Medicine ACN will go through some plan highlights and which partners are included in their network. We'll also show you how to look up a provider you are currently seeing or might be interested in seeing. We'll provide some resources on how to enroll. And lastly, we will wrap things up with a Q&A and where to get more information. Many of you may be asking, what is an accountable care network, also referred to as an ACN? An ACN is made up of providers such as primary care providers and specialists who work at clinics and hospitals. In an ACN, these groups of doctors, hospitals, and other health professionals work together to give patients high quality, coordinated services and health care to both improve health outcomes and manage costs. Coordinating your care means providers who are part of an ACN work together to ensure patients get the right care at the right time. By working together, these providers can reduce healthcare costs caused by such things as unnecessary or duplicative tests and procedures, and by promoting preventive care. This ensures everyone is on the same page about what treatments you are receiving, which drugs you are on, or whether you need testing or labs done. When HCA set out to create the ACN, our goal for our members was for them to receive better care through the collaboration of providers that I just described, and unnecessary medical services such as labs or diagnostic tests, and improve the long-term health of enrolled members in the hopes of preventing serious health issues or hospitalizations. UMP Plus is the medical plan that is made up of two ACNs that are offered by the SEBB and PEBB program. The two ACNs are the UW Medicine ACN, which we are discussing today, and the Puget Sound High Value Network, which was presented in a separate webinar. The UMP Plus plans have been in effect since January 1st, 2016 in the PEBB program and January 1st of 2020 in the SEBB program. Since its enactment, UMP Plus has seen large increases in membership, with enrollment currently at more than 47,000 members. UMP Plus offers lower cost shares for some services, as well as a lower deductible, all offered through a local network of doctors and specialists. Diving further into some of the perks of being enrolled in a UMP Plus plan. So it offers a lower medical deductible, which is $125 per person, or up to $375 for a full family. If the subscriber on the account has earned their wellness incentive through Smart Health, the subscriber's portion of the deductible is $0. Therefore, if it is a subscriber-only account and they earned their wellness incentive, the deductible is $0. There is also no annual pharmacy deductible. The UMP Plus plans offer free office visits with a primary care provider. However, please keep in mind that some related services, such as x-rays or labs, may be subject to the medical deductible and coinsurance. Some reasons to consider enrolling in a UMP Plus plan. It focuses on coordinated care with a network of providers who work as a team. It offers a full range of specialty care and specialty providers, and members have access to the Regence network of non-primary care providers, also referred to as support providers. These providers include physical therapists, labs, chiropractors, naturopaths, and massage therapists, among many others. This slide is a brief side-by-side comparison of UMP Classic and UMP Achieve 2. The UMP Classic plan is for PEB members, UMP Achieve 2 is for SEBB members, compared to the UMP Plus plans, which are offered in both programs. As stated previously, the UMP Plus plans have a lower medical deductible, no pharmacy deductible, and you pay $0 for the primary care provider office visit versus the 15% you would pay on either the UMP Classic and UMP Achieve 2 plans. Next up, I'll discuss who is eligible for UMP Plus. The UW Medicine ACN has a service area which covers Benton, Franklin, King, Pierce, Skagit, Snohomish, Spokane, and Thurston County. A subscriber must live in one of these counties in order to enroll in the UMP Plus UW Medicine ACN plan. You must also be an employee in their enrolled dependents, a PEB or SEBB continuation coverage member and their enrolled dependents. So that would be for unpaid leave. A PEB or SEBB continuation coverage or COBRA member and their enrolled dependent not enrolled in Medicare Part A or Part B, or a retiree and their dependents enrolled in the PEB program, but not enrolled in Medicare Part A or Part B. It is important to acknowledge that the UMP Plus UW Medicine ACN plan won't be the right fit for everyone. There is more to consider about this plan than just the lower costs. Subscribers should live within the UMP Plus network service area. This plan may not be right for members who prefer to see primary care providers, specialists, or receive services at hospitals and clinics that are not in the UW Medicine ACN's provider network. For example, if you prefer to see Virginia Mason, Franciscan Health, Polyclinic, or Providence providers, those providers are out of network for this particular plan, and you will likely pay a higher cost share. You may want to consider a different plan if your dependent child does not live in one of the counties mentioned earlier or lives out of state, for example, attending an out-of-state college, or if you yourself live out of state for part of the year, because there will not be in-network providers available to you and you risk paying higher cost shares. Next up, my network partner from Regence Blue Shield will walk you through some changes and benefits for the 2025 plan year.
Thank you, Lauren, and good afternoon. My name is Ashley Litt, and I work on the UMP account management team at Regence Blue Shield. Open enrollment begins October 28th and ends November 25th. There are no changes to the counties that make up the UMP Plus UW Medicine Accountable Care Network, also referred to as an ACN. The counties that make up the UMP Plus UW Medicine ACN service area are Benton, Franklin, King, Pierce, Skagit, Snohomish, Spokane, and Thurston counties. This plan is available to you if you live in one of those counties. Need extra support managing your diabetes? In 2025, both PEB and SEBB members will have access to a new diabetes management program that offers personalized support. Routine vision coverage will be separate from PEB medical coverage in 2025. Non-Medicare PEB and SEBB subscribers will be able to choose from 3 vision plans: Davis Vision by MetLife, iMed Vision Care, and MetLife Vision. The company administering your prescription benefits is changing its name to Array RX. Our new smoking cessation program offers more support than ever to both PEB and SEBB members. Now you have access to a dedicated care team, unlimited one-on-one coaching, personalized mobile content, and nicotine replacement therapy. The plan comparison shows you a side-by-side view of the 5 different plan choices. UMP Select, UMP Classic, and UMP CDHB plans are all available for enrollment worldwide and include network access to preferred providers worldwide. UMP Plus, UW Medicine ACN, and the UMP Plus PSHVN are available to you in their select counties. Each plan has an annual medical deductible, and some have annual prescription deductibles. The deductible is the fixed dollar amount you must meet each calendar year for services before the plan starts paying for covered services. Some items, including covered preventive services, are not subject to the deductible. Each plan also has coinsurance, which is the percentage of the allowed amount you must pay the provider on claims for which the plan pays less than 100% of the allowed amount. The annual out-of-pocket limit is the most you pay during a calendar year for covered medical services when you see a preferred or network providers, and for covered prescription drugs and products when you use a network pharmacy before the plan pays 100% of the allowed amount. Most plans have separate out-of-pocket limits for medical and prescriptions. Your network telemedicine options can be explored using ump.regence.com or by calling customer service. Costs for telemedicine visits with a network provider will be no more than you would pay for an in-office visit and may be subject to the deductible. For UMP Plus, UW Medicine ACN members, Dispatch Health provides urgent care home visits by emergency personnel for complex injuries or illnesses 7 days a week in Olympia, Seattle, Spokane, and Tacoma from 8 a.m. to 10 p.m. You pay the standard rate and it is subject to the deductible. Offer a variety of programs to help you improve your health. Learn more about these programs, including cost, eligibility criteria, and how to participate on the UMP website. Programs include diabetes programs, diabetes management, palliative care, maternity support, expert second opinions, tobacco cessation, and virtual self-guided behavioral health support, formerly My Strength, now Teladoc Health Mental Health. When you create an account for use on the Regence app and regence.com, you'll have a personalized experience tailored to your UMP plan benefits. Just have your member ID card handy when you create an account by downloading the Regence app or going to regence.com. The same account can be used for the Regence website and app. With your personal online account, you can see all member-independent health information and solutions in one place. Get personalized recommendations so you can make informed choices about your health, have convenient access to virtual care, easily estimate costs for procedures and services, and connect with your health and well-being programs. Enjoy a single, integrated experience across the Regence website and mobile platforms, and access ArrayRx with one username and password in the Regence app and regence.com when you sign in. After you create your online account for regence.com and the app, every time you sign in using your username and password, you'll go directly to your home screen, also known as the member dashboard. You'll notice this dashboard includes accumulators that are higher than the UMP Plus plan, as this dashboard serves as an example of the layout. However, it displays the UMP Classic accumulators. Think of it as your member dashboard where you can find useful information and resources, and view your claims and their status, view your plan's benefits and coverage, view the deductible and out-of-pocket max balances, find a doctor or provider in your plan's network, and pull a digital version of your UMP member ID card. Next up, we'll go over some frequently asked questions. Are referrals required for anything? No, referrals are not required for any of the UMP plans. How do I find out if my provider is in my plan's network? To find out if a provider is in your network, visit the provider search feature on the UMP websites listed below. How are benefits coordinated if I have other medical coverage? If UMP is your secondary plan, it is non-duplication of benefits. This means UMP will only pay up to what it would have paid if it were primary. We have two examples. The first example, your primary insurance pays $100. UMP pays nothing. The second example, your primary insurance pays $80. UMP would have paid $100, so UMP pays $20. Is massage therapy covered? Yes, massage therapy is covered as long as you use a network provider. A prescription from a doctor or chiropractor is needed. Is there coverage outside of the country? The Plus plans are for services inside Washington state. If you travel outside of the state and have a medical emergency, the plan will cover at the same rate. For non-emergent services, the plan will pay 50% of the allowed amount after deductible as there are no in-network providers outside of Washington state. Are virtual visits covered? Telehealth virtual services are covered under all UMP plans. Now I'll hand it over to the representative from the UW Medicine ACN.
Thanks, Ashley. Good afternoon. My name is Mandy, and I am representing Embright. Embright was founded by UW Medicine, Multicare Health System, and LifePoint Health to support members and connect providers across these high-quality health systems through a single, clinically integrated network of doctors, clinics, and hospitals. Through these partnerships, Embright is achieving our mission of enabling collaboration to improve the health of the members we serve. Our accountable care network includes some of the region's finest healthcare organizations. These members share our commitment to high quality, affordable healthcare, as well as excellent patient service and access. Together, we form the most comprehensive accountable care network in the region. We offer the most inclusive range of services available, from primary and preventive outpatient care to advanced specialty care in public and pediatric hospitals. Our network spans cities and neighborhoods. You will be able to find an expert provider for whatever you may need within the network. This is just a sample of the specialty services available within our network, which include cardiac care, cancer care, pediatrics, obstetrics and gynecology, neurosciences, and orthopedics. There's comfort in knowing that even if you have a rare, complex, or unknown condition, we can address that in the network. We have some of the best research organizations in the region whose discoveries drive much of our specialty care. Support services and support providers. These special provider categories include the wide range of healthcare services provided to support the work of primary and specialty providers. For services considered support, a UW Medicine affiliated provider or certain Regence network providers. However, seeing providers affiliated with the UW Medicine ACN helps your providers coordinate your care more effectively. Visit the website listed here to search for support providers within the network. With UMP Plus, UW Medicine ACN, there will be an entire team of providers working together to help you stay healthy and receive the best possible care. This includes wellness and prevention, identifying and treating issues early, and coordinating care to manage chronic conditions like diabetes and heart disease. All services are available through a single centralized contact center. The UW Medicine Contact Center can help you make an appointment or receive assistance with a referral to a specialty provider. Find out if a physician or healthcare professional is in the network, locate in-network clinics, and so much more. The contact center is available 5 a.m. to 8 p.m. Monday through Friday and 6 a.m. to 2 p.m. Saturday and Sunday. To find out more detailed information about the UW Medicine Accountable Care Network option, you can visit our portal to see clinic locations, our network providers, benefits of joining the UW Medicine Network, and our healthcare organization members. Our dedicated PEB and SEB websites allow you to access a variety of information about the plan, including how it works and how to identify in-network providers and facilities. The provider search function on the PEB and SEB websites allow you to search for in-network providers and facilities. It also provides links to the Regence site where you can search for support providers. And now I'll turn it back over to Lauren at the Healthcare Authority.
Thank you, Mandy. If you'd like to learn more information about the plans and benefits offered under the PEB and SEB programs, you can visit the HCA's Virtual Benefits Fair webpage at the links listed on this slide. When you are ready to enroll, you can do so by either visiting the new login page at benefits247.hca.wa.gov or hca.wa.gov/ERB. But we want to click your member type and log into Benefits 24/7. Or you can also complete and submit the appropriate 2025 enrollment change form, which is available at hca.wa.gov/ERB. Paper forms must be received by HCA This slide offers some more resources, so websites and phone numbers that you can call or look up to learn more about the UW Medicine ACN plan. I'll leave it up there for just a few more seconds. If you'd like to learn more about UMP Plus benefits, some general benefit information can be found on the ump.regence.com websites, or you can call the UMP customer service at the phone numbers listed below. If you'd like to speak to someone in person about the plan, you can visit the UW Medicine ACN booth at any of these benefit fairs. And at this time, we will go ahead and take your questions in the chat.